Welcome to Tuesday's coverage of COVID-19. Health officials here and elsewhere are stepping up their efforts to tackle the resurgence. Neighboring Japan is poised to announce a state of emergency for the Greater Tokyo area, while England has entered a fresh lockdown. Over in the US, the country is losing a life to COVID-19 every 33 seconds. I have our consul standing by now with more on the pandemic. So let's begin with the situation here in Korea. Now, here there's been a drop in the daily tally.
Yes, Sunny, quite a plunge, in fact. We have over 300 fewer cases than yesterday, with 715 infections reported this Tuesday. And domestic transmissions are even below 700, with a rise in imported cases now in the 40s. So we are seeing quite a number of fluctuations here. Last Tuesday, we had over 1,000 infections, and once we even dropped to the 600s on Sunday, again back to over 1,000 yesterday, and again a drop this Tuesday.
I see, and despite that decline in daily tally, I understand Korea has marked a very sad milestone with regard to the death toll.
Right, Sunny. Korea's number of COVID-19 related fatalities has surpassed 1,000, and double-digit figures of deaths have been reported every day since mid-December. So here is Prime Minister Jung Se-kyun on what he had to say on this matter.
In the past month, around 440 people have lost their lives to COVID-19, and the total death toll has surpassed 1,000 today. Most of the patients were senior citizens above the age of 70 at nursing hospitals or nursing homes.
So as of this Tuesday, the death toll stands at 1,007, with 26 people having lost their lives in the past day. And out of the 17,800 people currently in quarantine, 386 patients are in serious or critical condition. That's 35 more than yesterday. Now, overall, we have a decline in cases this Tuesday, as I mentioned before. Here in Gyeonggi-do Province, Incheon, Seoul, the metropolitan region is seeing a decline in infections, but the capital had its highest ever daily death toll at 11 this Tuesday, and with that, the accumulated number of deaths in the capital stands at 204, similar to Daejeon 203, and the highest in Gyeonggi-do Province at 295. Now, globally, almost 10,000 deaths were reported in the past day, now at 1.86 million, and 86 million is the number of total accumulated cases. If we take a closer look at the countries most affected, the U.S. at 21.35 million had almost 240,000 new infections, and the U.K. has surpassed the total caseload of France, now at 2.7 million, and is seeing record high daily figures of over 58,000 in the past day. And that is while the U.K. has also implemented a nationwide lockdown, which will be in effect until mid-February. We also have South Africa with over 12,000 new infections. So South Africa and the UK both dealing with the new COVID-19 variant. Meanwhile, in neighboring Japan, cases have been at around 3,000 almost for a week now. And that's also a place Sonny will connect in a bit. And I will be back in a bit too after the government briefing. Sonny?
Right, so thank you for that. Vaccination campaigns are now underway and in quite a few countries amid hopes for a return to a sense of normality and an end to the pandemic. Korea, for its part, is poised to launch its campaign late next month. I have Yoon Jung-min here in the studio now. Welcome, Jung-min.
Hello, Sunny.
Jung-min, let's start off with the U.S. vaccination campaign. How are things progressing there?
Sure, Sunny. So according to the CDC's COVID-19 data tracker, over 4.5 million people have received first vaccinations as of January 4th. But it's far below the U.S. government's plan to immunize more than 20 million people by the end of last year. Meanwhile, cases are continuing to surge, with over 20 million Americans infected in total, which is over 6% of its population. Top U.S. infectious disease expert Dr. Anthony Fauci commented on the soaring numbers. Take a look.
When you have a family-oriented season, and then you have the cold weather, people doing things indoors much more than outdoors, and this is what happens. It's terrible, it's unfortunate, but it was predictable. Now, my concern is that it could get worse over the next couple of weeks.
In the meantime, Fauci said in another interview that President-elect Joe Biden's pledge to administer 100 million shots within his first 100 days in office is achievable. He also rejected President Trump's claim on Twitter that COVID-19 deaths and cases in the country have been exaggerated.
I see. Meanwhile, Chongmin, how is the campaign coming along in other countries?
Sure. So the UK has started distributing the first doses of Oxford and AstraZeneca vaccines. More than 500,000 doses were distributed, with priority being given to healthcare workers. Along with Pfizer and BioNTech's vaccines that have already rolled out in December, the UK expects to have more shots widely available. Take a listen.
So we're aiming to vaccinate the most vulnerable people first. That includes our staff, other NHS staff and care home staff as well. So we have been contacting those groups of people to notify them of the vaccine being available.
The 2 doses required will be given in a 12-week interval rather than the initially planned 4 weeks in order to get more people vaccinated. Denmark also approved a delay of the second shots of the vaccine, while Germany is reportedly mulling whether to do so. In the meantime, Israel has the highest vaccination rate in the world. So far, it has given inoculations to more than 1 million people, or around 13% of its population. Also, Vatican City, which is the world's smallest sovereign state, expects to have enough vaccines for everyone in the second week of this month. Over in Japan, its government aims to start vaccinations from the end of February. With cases surging, the Japanese government is expected to declare a new state of emergency in Tokyo and 3 prefectures in the surrounding regions.
I see. Meanwhile, back here in Korea, Chongmin, what is Korea's vaccination plan?
Sure, Sunny. So Korea expects to start rolling out first vaccines as early as February. The country's drug regulator said on Monday that they are currently reviewing AstraZeneca's vaccine, which has been filed for approval here in Korea. Take a listen.
We will thoroughly assess the safety and efficacy of the vaccines so that people can get the shots without having to worry. We will also prioritize and expedite the regulatory approval of vaccines over that of other drugs.
The Ministry of Food and Drug Safety hopes to complete its evaluation within 40 days and start distributing the vaccines by no later than the end of February. The first people to be inoculated may include healthcare workers and the elderly. As for other vaccines, Korea expects to have enough doses for 6 million people from Janssen and 20 million from Moderna in the second quarter. In the third quarter, the country also hopes to have vaccines for around 10 million people from Pfizer. However, we do not know yet when we will get vaccines from the COVAX facility for around 10 million more.
Well, I suppose in the meantime, we'll have to put into practice the wisdom of the words, prevention is better than cure. So what can we do to stay safe while we wait for the vaccines to arrive?
That's right. First, the health authorities say ask people to maintain social distance and practice good hygiene. The government has extended level 2.5 social distancing rules for the capital area and level 2 for other regions until January 17th. Also, Korea has extended its ban on private gatherings of 5 or more people, and it now applies to the entire nation, not just the capital area. At the same time, it has eased restrictions on some businesses. Private academies in the capital region can open as long as they only have a total of 9 students and staff present at one time. Also, ski resorts can operate as long as they limit their capacity to 1/3 and close after 9 p.m.
I see. All right, Chongmin, thank you for the coverage. Hope to see you again soon.
My pleasure.
Right, it's time now for the regular briefing on COVID-19 here in Korea for this Tuesday. Health officials have extended level 2.5 social distancing here in the Greater Seoul area, as our Yoon Jung-min just said, and level 2 social distancing in the rest of the nation with stringent restrictions on gatherings for social purposes. The briefing is about to start. We'll come back to you afterwards with a summary of it.
역학조사 분석단장의 설명이 있겠습니다.
Let us now begin our regular briefing on the COVID-19 situation here in South Korea. As of January 5th at midnight, we have 672 new local infections and 43 new imported cases. And the total caseload now stands at 64,979. Currently, we have a total of 17,800 people in quarantine undergoing treatment, and 386 of them are in severe or critical conditions, and we had 26 additional fatalities. The death toll now stands at 1,007. I extend my deepest condolences to the deceased and the members of the bereaved families. Let us first go over our major updates on our domestic infections. First of all, in the metropolitan area in Seoul's Yangcheongu City, in relation to the second nursing hospital. After the 1st of January, we have identified 17 additional cases, and in total, we have 33 cases being confirmed to date. And in Seoul Jungnam-gu district, in relation to a religious facility, after the 1st of January, we have identified 2 more patients, and total we have 63 cases being confirmed to date. And in Gyeonggi-do province, in relation to a construction site in Yangju City, we identified additional cases of 36, and in total, we have a total of 37 cases being confirmed to date. And in Suwon City of Gyeonggi-do province, we have the second religious facility, and we have identified that these cases were in relation to the Bible study gathering held in Asan City of Chungnam province, and we have 15 additional cases being confirmed, and in total we have 32 cases being confirmed to date. And moving on to Gangwon-do province, in relation to a religious facility in Wonju City, we also identified additional cases. 37 additional cases have been confirmed, and in total 38 have been confirmed to date. And in Chungcheong area, in Chungju City, in relation to a second religious facility, that is, we have identified additional cases of 15, and the total cases there now stands at 16. And in Chungbuk, Gwaesan, Eumseong, and also Gwaesan-gun County, we also have the hospital. And in relation to this hospital, we have 22 additional cases being confirmed. And in total, we have 281 cases. And in Honam region, in relation to Gwangju City, in relation to a nursing hospital, there we have 13 additional cases being confirmed, and in total we have 78 cases being confirmed to date. And in Gyeongbuk province as well, in Gumi, we have the second religious facility. We have identified a first index case on the 30th of December. 13 additional cases have been confirmed since, and a total of 100 people have been confirmed to date. And also in the city of Ulsan, in relation to a mission center, we also identified 19 additional cases, and in total, now we have 119 cases to date. And as for other cluster infections, please make your inquiry to the spokesperson's office following the completion of the briefing. Today, we would like to go over the fact that we have the high risks posed by the new variant of the COVID-19. And we are assuming that the new variant stemming from Britain and South Africa have a very high infectious rate. And we have identified a total of 12 cases here in South Korea. And all of these cases have been identified at the points of entry. And therefore, we do not see that they have also had local transmissions. These are very different, starting one stemming from the Britain and another from the South Africa. However, one commonality is that they affect the 501 number of protein. And while we have many questions still, there are no scientific grounds as for how can the virus new variant could affect the vaccine efficacy, and we are still awaiting for further results. And the new variant is a very natural process, a phenomenon indeed in the history of the virology, and we believe that going forward we will have certain further mutations going forward. And most of these virus mutation happens at places that do not affect the fatality of the viruses. However, this could also have a hike in the transmissibility, and therefore we are also continuing to do our research on the new variant. And next, we would like to go over some analysis and forecasts for the current outbreak. Today, we had 672 new local infections, and this is the first time that we dropped below the 700 mark in about a month. And we would like to go over the outbreak situation here in South Korea during the first week of 2021. And we would like to state that today we saw the first downturn of this third wave. And last week, we have seen that the reproductive rate of the virus stands below 1. And we also have sporadic cluster infections. Therefore, it is very difficult for us to give you a precise forecast. However, depending on our figures, during the past week, we had about daily cases hovering at around 900 to even 1,000. And if this still continues for the time being, we believe that the virus cases could go down for the time being as well. Nevertheless, we are very cautious of the outbreak because we need to also continue to comply with the social distancing measures, and also virus prevention measures are very important and they need to be sustained going forward. In other words, our choice or our actions could affect the future fate of our outbreak. Currently, we have the COVID-19 outbreak. However, there are many inconveniences that are caused by social distancing measures and quarantine measures, and we also understand these aspects. Nevertheless, we need to contain the virus clearly so that we do not have more socio-economic damages incurred by the COVID-19, and this has been learned through our past experiences. And despite these downturn for the time being, we need to put in place stringent social quarantine measures, and we would like to once again highlight that this is inevitable, and I would also like to apologize for saying this as well. And yesterday was the first day when we had the pan-COVID-19 response scheme at the quarantine authorities here in South Korea, and it's been a month or so. And it was also the starting point where the government had to have concerted efforts in dealing and responding to the COVID-19. And going forward, we would like to take a step even further. We would like to say that COVID-19 cannot overcome Korea.
Right, that was Lee Sang-won with Tuesday's afternoon briefing. Soa, what was the gist of his address?
Well, let's begin with some of the major outbreaks the country reported. New infections were traced to nursing hospitals, religious facilities, and also a construction site in Gyeonggi-do province. And it looks like one religious facility which added 15 new cases in Gyeonggi-do province's Suwon is also linked to a Bible study in Chungcheongnam-do province. So that example shows us how these cluster infections are spreading across the nation. But there is also some positive news that Yi mentioned. We are seeing one of the first drops in the third wave of the pandemic here in Korea, which means also the reproduction rate of the virus has dropped to below 1 recently. But he mentioned it is difficult to precisely forecast the next development of the virus, as we just recently had cases above 1,000, but the numbers may go down in the near future if the trend continues. However, social distancing must still be adhered by.
Of course. All right, so thank you for that. I'll see you again tomorrow.
See you tomorrow.
Authorities in Japan are tackling their worst outbreak yet, with a record 4,520 infections last Thursday alone. For more on the situation there, I have Kosuke Takahashi live on the line. Welcome, Kosuke.
Hi.
Now, what appears to be fueling these record daily numbers there in Japan?
Okay, there are a couple of reasons. First, many people went to restaurants and karaoke bars for the year-end party in December. Especially young people did so. Most young people don't have any fear of the coronavirus because they think they will not have a severe illness as they are young and healthy. It is true, young people may be okay, but remember, Japan is the world's most aging nation and society. Old people have a higher risk of being infected. there is also a seasonal factor. Japan is having a cold winter and more people are confined indoors. This is increasing the spread of the coronavirus recently.
Right.
Sunny?
Kosuke, Prime Minister Yoshihide Suga has spoken of the possibility of a state of emergency for the Greater Tokyo area. Please tell us more about the details of his address this past Monday.
Okay. Prime Minister Suga said the Greater Tokyo metropolitan area accounts for more than half of the country's total infection cases. So Suga administration is planning to declare a state of emergency for Tokyo and 3 neighboring prefectures. 3 neighboring prefectures means Kanagawa, Saitama, Chiba. Declaration gonna be issued later this week, probably effective on Friday, in order to prevent the spread of the coronavirus. The problem is, declaration doesn't have any legal binding power. There is no punishment. So the government is now trying to amend the law to have a legal binding in the next diet session starting on January 18th, Sunny.
I see. Kosuke, according to Japanese daily The Mainichi, top CEOs in Japan are opting for under-the-table immunizations with a Chinese vaccine. What is the public response to this? And going further, what is the vaccination plans in Japan?
Okay. Mainichi Shimbun reported this news as a front-page headline on New Year's Day. The public reaction has been largely negative. Some said it's totally illegal to smuggle non-approved vaccine from abroad. Others say they are scared of the Chinese vaccine because the safety is not assured yet. The Prime Minister Suga said Japan gonna make available vaccine from February, just like South Korea, Sunny.
Right. Now, meanwhile, last week, Japan identified its first case of the coronavirus variant from South Africa, Kosuke. Now, this follows reports of more than a dozen cases of the variant from the UK in Japan. What is the latest with regard to these variants over in Japan?
Okay, so far, Japan has confirmed about 20 cases of the variant from Britain and only 1 coronavirus variant found in South Africa. Japanese government is afraid the new variants are much more contagious and hard to control. Japanese media has reported vaccine may not be effective, especially against the South Korean variant. Sunny?
You mean the South African variant, right?
Sorry, South African variant.
Right.
They are much more contagious.
Right. Kosuke,
yes.
Despite the challenges and tangible public opposition, I understand the government has vowed to move ahead with its hosting, that is, of the Olympic Games. Can you tell us a bit about that, please?
Yes, the government is still moving ahead with plan to hold Tokyo Olympics, but the public opinion is gradually becoming against holding Olympics this summer. For example, in mid-December, more than 30% of the respondents to NHK opinion poll have said Olympics should be cancelled. Meanwhile, only 27% said Tokyo Olympics should be staged. And then behind this negative impression of the Tokyo Olympics is the total cost. Total cost of the holding Olympics has reached more than 3 trillion yen, which is about 29 billion US dollar. And then this is the most expensive Summer Olympics ever in the history. More Japanese are becoming against the Olympics because of the cost and also the spreading of the coronavirus recently,
Right.
Sunny.
Which is quite understandable. All right, Kosuke,
Yes.
as always, thank you very much for making the time to join us live at this hour with your thoughts.
Yeah, most welcome. Thank you.
Right. Now, in this next report, we seek to answer some of your questions about the new strains of the coronavirus reported in the UK and South Africa, respectively.
Just a month after the UK kicked off its public vaccination campaign, fresh concerns are now mounting in the country over the emergence of a new variant of the coronavirus.
We have identified a new variant of coronavirus, which may be associated with the faster spread in the southeast of England. Initial analysis suggests that this variant is growing faster than the existing variants.
Another new variant has also been identified in South Africa, which, along with a new strain in the UK, has been spreading quickly across the world in recent days.
현재까지 영국 변이 바이러스는 9건, 그리고 남아공과 관련된 변이 바이러스는 1건, 등 총 10건이 보고되었습니다.
This is not the first time that the coronavirus has mutated to take on new shapes and forms. The SARS-CoV-2 virus is composed of 6 major subtypes, with the G strain being the most prevalent and also more prone to mutations. The latest variants from the UK and South Africa both fall under the G subtype. This leads us back to a familiar question. Why does the virus mutate?
새로운 세대가 나타날 때마다, 즉 한 부모 세대에서 다음 세대로 넘어갈 때 당연히 변이가 쌓이게 되고요. 코로나 바이러스는 바로 RNA 핵산을 유전 정보 저장 매체로 사용하죠. RNA를 유전 정보 저장 매체로 사용하는 RNA 바이러스들에서는 이러한 변이의 축적이 아주 일상적인 현상이라고 말씀을 드릴 수 있습니다.
Although no clear link has been established between the likelihood of a mutation and the race and gender of the patients, early findings show that patient-derived mutations are more likely to occur in the elderly.
만약에 어떤 청년에게 바이러스가 감염이 됐다, 그리고 그 사람은 신체 건강하고 면역학적 시스템도 아주 완벽하다. 그렇다면 비록 바이러스가 감염되어서 증식을 한다고 할지라도 다양한 바이러스의 변이주가 모두 다 함께 성장하기는 어려울 거라는 얘기죠.
So what is it about this new UK variant that makes it potentially far more dangerous compared to other mutations in the past?
This virus has around 20 different changes in its genetic material. Around 8 of them are in quite important parts of the virus spike protein. And this virus has been shown to potentially have higher viral load in the nose and throat, and also higher numbers of cases from each infected patient, suggesting that the virus is more transmissible.
The new variant is only 4 months old, but was responsible for some 60% of the UK's total cases in the month of December. Experts say the new strain could be up to 70% more transmissible compared to other variants. The South African variant also appears to be highly contagious, although more data and research are needed to determine the exact nature. There's also fear that existing vaccines may not be effective against the new variants, but experts say it's no time to panic, despite the highly contagious nature of the new variants.
바이러스들은 변이를 하면서 감염력이라든지 중증도가 높이는 방향으로 변할 수 있기 때문에 우리가 계속 감시를 해야 되는 거고요. 본질적으로 확진자 숫자를 줄여야 되는 것이 가장 중요하겠죠. 해외에서 귀국하시는 분들에 대해서는 2주 자가격리와 진단검사를 의무화하고 있기 때문에 문제가 없을 것 같고요.
The emergence of these new variants have underscored the importance of sticking to the basics in maintaining our rigorous containment measures.
올해 대한민국의 최우선 과제는 코로나의 긴 터널에서 하루속히 벗어나는 것입니다.
With investments in public health, supported by an all-of government, we can ensure that our children and their children inherit a safer, more resilient, and more sustainable world.
It has been stressed time and time again that the pandemic is a global challenge, one that needs to be tackled through a well-coordinated global effort. And more recently, with the detection of the highly transmissible variant over in the UK and South Africa, there is a greater call for interaction among nations to curb the latest contagion. I have Dr. Alice Hyungyang-Tan from Miss Mary Women's Hospital. Welcome back, Dr. Tan.
And thank you.
And I also have Professor Son Ho-jun from Johns Hopkins University joining our talk virtually from Daegu. Welcome, Professor Son.
Thanks, Sunny. Thank you for having me again.
Right. Dr. Tan, the recent variants from the UK and South Africa are the latest in a line of mutations that we have witnessed during this pandemic. Are we poised to see more variants in the new year?
Absolutely. I mean, the virus has been mutating since the very beginning, and GSED and NextStrain are international initiatives that have been tracking the changes from the beginning. And there have been multiple mutations, thousands to be exact. Viruses evolve and adapt with time. That's what they do. And we need to continue to keep an eye on these changes and track them and to assess for the trends and see if there are any major changes that could affect the virus's behavior. For example, its transmissibility. This recent UK strain seems to be much more transmissible compared to wild types, or the virulence. Fortunately, we have not seen any major changes that affect how severe the disease is caused by the virus, but certainly that is something that is possible in the future. Also, there might be changes that affect the interaction of the virus with our immune system. And so, of course, that's a question in terms of will currently developed vaccines be effective against mutated strains, not just now, but in the future. And so definitely, I think in the future, especially with the added what we call evolutionary pressure of massive vaccinations, that the virus will change. We just need to keep an eye on those changes, keep on, testing it against the therapeutics and vaccinations that we have in place, and make sure that we stay one step ahead.
Right. So against this backdrop, Professor Sohn, what can the international community do to strengthen collaboration against such concerns or threats?
Right. So it's really important to first note that these developing countries have long been suffering from diseases of poverty, including the infectious disease. And they are really in a desperate need of assistance, both in terms of financial supplies and the knowledge. And I think this pandemic has created a lot of disparities. Well, not created, but actually revealed a lot of disparities, not just in the affluent countries, but across the globe. So it is really the global mindset and the affluent countries' interest to also provide assistance and scale the international aid. And I think we need to do this in terms of increasing the better incentives and the governance so that we can assure accountability throughout the aid process. The other thing that has revealed throughout this pandemic is that there's a lot of regulatory and the laws that makes it difficult for importations for aid purposes had become a significant barriers in supporting and other administrative processes. So I think we need to be more innovative and flexible in improving these types of barriers for the countries. And ultimately, we need to be mindful that this is a global pandemic. It's not just affecting the countries like us, which are very affluent, the U.S. It's influencing every single country. So countries are very strapped and stranded for financial and other resources. So, and again, I think U.S. has been withdrawing from these international donations and donorships and WHO partnerships. And these are very challenging times where we need to be very innovative in the international aid and cooperation.
Right, and there are hopes that the Biden administration will make an effort to change that. Dr. Tan, the World Health Organization has urged for active genomic sequencing of the coronavirus and for the sharing of such related information among nations to come up with better strategies to cope with future variants of the coronavirus. Please tell us more about genomic sequencing and its importance.
Right. So genomic sequencing, it's very difficult to describe this in simple terms that the public can understand, but you can consider that the gene sequence of a virus is made up of, either DNA and RNA, and DNA and RNA are the alphabet, so to speak. They're the software, or the language of all life forms. And so the older method of genetic sequencing used to be called the Sanger. It was the Sanger method. Now we use next generation sequencing, also known as NGS, basically, we are looking at the makeup of the virus in terms of its genetic code. And then we compare it against a library of previously circulating strains to see if a new genetic mutation has taken place. It's as if we had the code, the letters A, B, C, D. And if that gave us instructions to make a certain protein, that's what we call the wild type or the standard. If we substituted the A for a B, so instead of A, B, C, D, B, B, C, D, that would result in a completely different protein. So you could have substitutions, you could have deletions. So instead of A, B, C, D, it's A, C, D. That would also result in a different configuration of a protein. So we want to keep on scanning and tracking for these mutations. So because they can result in critical or sometimes not so critical changes in the vaccine that can lead to changes in how it behaves. It's very important that we do this on a global basis so that we can know in terms of the trends of what's going on globally, but also so that we can pick up critical changes early on.
I see. And Professor Sun, what in fact is the status of genomic sequencing within countries, and how active is the exchange of information among countries?
So I think a lot of reports have indicated that UK is definitely the leading country in terms of sequencing the genomes for COVID and other things, and New Zealand is definitely following. And I have to assert that our country, Korea, is also doing well in terms of per diagnosed case of the whole genome sequencing. So we're not that behind. The other thing about the whole genome sequencing, as Dr. Ten has pointed out, it's very complex and costly endeavor, and it requires significant laboratory infrastructure, and these infrastructures are virtually non-existent in the developing world. I wouldn't say non-existent, but it's developing, so through international aids. And we're to put you in terms of the context, cost per test run on these whole genome sequencing used to be around $1,000, and it has dramatically reduced, to about $100 with the new next generation sequencing. And there's the COVID-19 situation has definitely created a favorable market to reduce these prices. But we're talking about a lot of people also live in the developing world, and we need to also monitor these types of virulent variants, and we need these capacity, the whole genome sequencing capacity to do so. And in the context of developing countries, they're struggling to justify molecular tests that are for tuberculosis, for example, which is the highest global the infectious disease burden that it shares. They're definitely making it difficult to justify a $15 test for TB. So it's going to be very difficult for them to justify a $100 test.
Right. Dr. Dan, global solidarity in vaccine distribution is another key issue. Do you believe the COVAX facility is doing its part to ensure equal access to vaccines?
Absolutely. So the goal of COVAX is to have delivered 2 billion vaccinations throughout the world by the end of 2021. And to this end, they are supporting 190 countries. 92 of the countries are in the low and middle income bracket. 97 countries are in the middle and upper income bracket. And so they are helping to procure but also deliver vaccines. Together, this makes up of more than 80% of the world's population. So the COVAX facility is our best bet forward to really make sure that the global community is going to be immunized, properly against COVID-19. Under the COVAX facility, UNICEF and also the Pan American Health Organization, they are, working behind the scenes at the front lines to make sure that vaccines are procured and also delivered, especially to the low and middle income countries that may not have the resources to purchase and deliver vaccines on their own. And as far as I could tell from official sites, the COVAX facility does seem to be on track for delivering its first batches of vaccine in the first quarter of 2021, eventually to that goal of 2 billion doses by the end of 2021.
Right. Professor Sohn, aside from the task of securing vaccines, less developed countries also need to prevent outbreaks fueled by the new variants of the coronavirus. How do you assess their abilities to this end?
Yeah, so as I mentioned earlier, I think detecting the virulent virus and also diagnosing people and putting them on treatment requires a vast amount of structure, the healthcare infrastructure. I think in the last show I mentioned that in order for currently available treatment to be effective, and in order for vaccination coverage to be effective, we need to have these infrastructure ready to diagnose, test and treat, and then also monitor these virulent viral strains in the country. Unfortunately, many of these developing countries lack even the basics of performing diagnostic tests. For tuberculosis, we have a lot of people lost to follow during the pre-diagnostic stages and even pre-treatment stages, and this creates a fuel for the infectious disease to become create more outbreaks. So I think the current efforts to increase to secure and increase the vaccine coverage it's great, but the COVAX, the 2 billion doses that they have so far secured is not close enough for us to realize any sort of a herd immunity in these countries. So I think more efforts, and it's also in the interest of our affluent countries to increase awareness and increase the support to improve the infrastructures in developing countries, because we'd like to also. There's a lot of interaction globally, both travel and the economic interactions that makes it difficult for us to not spread the virus without any sort of measures in developing countries.
Dr. Tan, what are your thoughts on plans to disclose the identities of those who have or have not taken the COVID-19 vaccine, as is being planned over in Europe?
Well, there are a couple of terms that are being discussed, immunity passports and vaccination certificates vis-a-vis COVID-19. In the first, an immunity passport would be a documentation saying that a person has recovered from COVID-19, and so now they are immune and perhaps free to travel and interact socially. Vaccine certificate, I mean, this is nothing new. We've used these many times at schools, places of work, and at the border to make sure that the person is up to date on health vital vaccines. The problem is that in the past, these documents may have been helpful because the diseases were well defined. We know all about measles, we know all about chickenpox, and then the vaccines used against these diseases are fully approved, and we know how they work. We cannot say the same thing about COVID-19. We do not know the durability of immunity against COVID-19 after natural infection or after immunization. I mean, these vaccines have been studied now for maybe 2 months, 6 months at the most, depending on when they got started with their phase 3 trials. But these trials are still ongoing. They will be run for 2 years. So it will take time before we amass the information that we need, I think, to be able to give out these documents, passports or certificates with any degree of confidence. Until that time, they may actually work against us. And I think that's what the WHO has warned, that when a person has this document, they may think, oh, I don't need to wear a mask, or I don't need to socially distance, but that is not true at all. We need to keep up with what we call the non-pharmaceutical measures, the masking, the distancing, the hand washing, all of this. Until herd immunity is truly achieved. And that's going to take a long time. So let's think years, not weeks or months.
Right. It might, of course, offer a false sense of security, as you just mentioned. Professor Sohn, what are your thoughts regarding calls for reform of the global health body to better respond to pandemics?
Yeah, so in this regard, I think there is definitely a justification for that. But it's, before we talk about any reformations or roles of WHO or international institutions, I think, it's important to be mindful that for public health matters, many of the successes to get unnoticed, while failures such as the failures that have demonstrated early in the pandemics prompt many criticisms and prompts the major structural changes in the governing institutions. So with that, I think the WHO definitely has received a lot of criticisms for its early response to pandemics, but it has definitely an important role in mediating and guiding the countries and across the globe through this pandemic, as well as many of the important public health issues. And we also have to think that we cannot be certain that if the response was better for WHO early in the pandemic, that we will be in a better position. So with these things, I think the WHO also, we need to think about institutions like WHO. Many of the countries that Dr. Tin earlier on mentioned, more than 90 countries are developing nations, and 80% of the population reside in that, and they do not have a very functional health institutions like we have here in Korea or US. So WHO serves as important guidance for them, and I think that can't be ignored. Right. So I think we don't need to reinvent the wheels by creating new institutions or things like that. We just need to make sure as member states enact with WHO in partnership so that we can strengthen their position in the global era, and then also use other platforms such that WHO and other institutions have created, such as GIS AID, which publicly shares information on genomic mutations and whole genome sequencing. These other types of institutions and bodies, we need to use them more effectively so that we can fill in the gaps of the global institutions.
Right. All right, Professor Son, thank you very much for your insights. And Dr. Tan, as always, thank you for being with us today. Right, global interest in vaccines and therapeutics is growing, given the alarming spread of the virus across the world in recent days. Accordingly, tomorrow, we touch upon this topic with our panel of experts. Thank you for watching.